Okay. Good morning, everyone. This is Dr. Rafat, consultant microbiologist working in a tertiary care setup. My topic is Chrysobacterium indologenes bacteremia, a repercussion of device colonizers from heart and lung transplant unit of a tertiary care setup. Before starting my presentation, I would like to mention the reason for undertaking this study. Blood cultures received from bacterial culture from heart and lung transplant units grew mostly uncommon pathogens or uncommon organisms such as Elizabeth Kinge meningoseptica, Chrysobacterium indologenes, Aeromonas species, or Sphingomonas species. Characteristic features of these organisms are a result of prolonged antibiotic use, either due to previous MDR pathogens, prolonged antibiotic use due to previous MDR pathogens, or long-standing indwelling catheters. Strikingly, the usual antibiotics or high-end antibiotics which are used for treating the gram-negative bacteria do not work for these organisms. Hence, this study was undertaken in order to identify or preemptively identify the organisms based on colony morphology and formulate an empirical antibiogram which would help to guide the clinicians in prompt change of antibiotic and doing the needful. Coming to the introduction of the topic, Chrysobacterium species are a group of non-motile, catalase positive, oxidase positive, indole positive, non-glucose fermenting gram-negative bacilli. The most frequent isolates of Chrysobacterium species include Chrysobacterium indologenes, Chrysobacterium meningosepticum, and Chrysobacterium glium. Chrysobacterium indologenes was previously known as Flavobacterium indologenes, first described in Taiwan by Hu et al. Coming to the relation of Chrysobacterium indologenes with the hospital settings. It is mostly an environmental pathogen, and it is found in water systems and wet surfaces, which serves as a potential reservoir of infection. There are various reasons which can be linked to Chrysobacterium indologenes staying in the hospital environmental setups. One being multiple devices which might be present, especially in a high-end setup such as heart-lung transplant units. It can act as a colonizer in various medical devices such as respirators, ET tubes, mist tents, ice chests, various syringes, etc. It also resists chlorination and can survive municipal water supplies. To jot down, the risk factors mainly includes prolonged exposure to broad-spectrum antibiotics or colistin, long-term indwelling devices, and infections. Many studies, there were few studies which I have read, which suggested that following surgical interventions, this organism was isolated. The aim of the present study is to assess the prevalence of Chrysobacterium indologenes in patients admitted in heart-lung transplant unit, to assess the antimicrobial susceptibility pattern, and to identify or preemptively diagnose based on colony morphology and prepare an antibiogram. It is a prospective study of over a duration of 6 months with 50 inpatients in heart-lung transplant unit. All the blood culture samples received from HLTU unit were processed using BACT-alert instruments. All positive cultures were examined following gram staining and were subcultured on blood agar and McConkey agar on flagging positive. Colony morphology on blood agar showed smooth circular mucoid colonies with beta hemolysis, and a distinct yellow pigment is present due to the presence of flexurubin. This yellow color was very helpful in preemptively identifying the organism. And one more characteristic feature of this organism was it mostly did not grow on McConkey agar. Even though McConkey being most commonly used plates for isolating gram-negative organisms, these organisms tend not to grow on McConkey agar. On blood agar, they grew as yellow pigmented colonies, and when 10% KOH was canted onto these colonies turned red. because of the production of flexirubin. These colonies were isolated, processed in Vitek-2 system for identification as well as antimicrobial susceptibility testing. And the results are as follows. Of the 50 blood culture samples received, 15, that is 30% of the patients had grown Chrysobacterium indologenes. Coming to susceptibility pattern, our isolates were susceptible mainly to minocycline, followed by cotrimoxazole, levofloxacin, ciprofloxacin, vancomycin, and piperacillin tazobactam at various percentages. All the isolated had one thing in common. They were unanimously resistant to all the beta-lactam antibiotics, carbapenems, aminoglycosides, and colistin. Our study was in conjunction or similar findings with the other studies which were conducted previously. Sentry was one of the biggest studies conducted in 2004, which had studied the various pathogenesis, reasons for various pathogenesis for it to cause infection and various antibiotics and their susceptibility pattern. Our study concluded minocycline and cotrimoxazole as the best empirical management therapy for the patients. Similar studies were, similar findings was given by Chaw et al., Jain et al., and Sentry. The limitation of the study is we couldn't exactly analyze in cases where the patients couldn't recover, we couldn't identify what was the actual cause of it, because since the patients are admitted in HLTU had immunosuppression, HLA income, various reasons. Hence, only positivity of blood culture alone could not define the mortality or the outcome of the patient. To conclude, the present study suggests that Chrysobacterium indologenes can cause nosocomial bacterial immunoinfections in immunocompromised patients with other risk factors, but preemptive diagnosis, that is proper reporting, that is conventional method, proper reporting can guide the clinician in telling about the specific organism. One thing more about Chrysobacterium or other non-fermenters such as Elizabeth and all is these organisms are not even picked by molecular sepsis panels and all which are available. Hence, microbiology culture plates serves very important role in identifying and guiding the clinicians for diagnosis and treatment. Newer fluoroquinolones and trimethoprim sulfamethoxazole may represent the most appropriate antimicrobial agents to treat the infections caused by these pathogens. Thank you.